Okay, a short film, 2 minutes or less, I'm going to try about ozone, what it does for you, how it does what it does, and the process of giving ozone through IV therapy. Shauna, do I have your permission to get you on film just for a quick second? She will be the patient for today. I have a 20 gauge IV in right now. We're going to catch this live. We're going to try to unclamp here. We got a tourniquet, which puts a little bit pressure up here, narrowing the circulation so that we have blood coming out of the IV and into a bag of saline, normal saline and isotonic solution mixed with a little bit of heparin so that the blood does not coagulate as it's collecting. This cartridge here is for a lighting system we have called a hemilumen polychromatic device, all fancy words for ultraviolet lighting through the blood. What that will do in layman's terms, and I'll get in more depth in another video, is activate the mitochondria, which is the powerhouse of the cell. It will help boost the immune system, and I can program numbers in and rife. I could do something called rifing, which is throw some vibrations into the blood that would either agitate or promote things to happen in the body. More on that later. As you can see, the blood is working its way down via gravity. I have the bag of saline there, lower than the patient's heart. There's the arm. And next to it, I have some methylene blue. Methylene blue is used in conjunction with ozone because ozone is going to cause what is termed oxidative stress. Oxidative stress occurs when electrons and atoms are either sharing with each other or stealing from each other. Two things interacting in the body. Usually what happens here is the advantage of having ozone and the advantage of ozone being unstable and its ability to decay quickly in the body is that oxygen, that extra oxygen molecule that makes oxygen into ozone, so you have O3, is what breaks off and causes the oxidative stress. Oxidative stress in the body will promote and induce active immunity to viruses and bacteria. The body's natural processes of creating its own antioxidants, such as superoxide and the other natural antioxidant that we produce is glutathione. Yes, people can get glutathione outside of producing their own to give them a boost, but we like to use our own body's natural defenses, whether we can promote it or get it exogenously, meaning from the outside. So, ozone helps with oxidative stress, which I already explained. Oxidative stress helps kill bacteria and viruses in the blood. So we're cleaning the blood, we're sort of sterilizing the blood and promoting the body to make its immune system do the exact same thing. We're just giving it a boost. This red light therapy, another video on that later because that's a whole discourse, is going to promote circulation. So if I put this on the liver or outside of the abdominal wall next to the liver, I'm going to increase oxygen by increasing circulation to the liver. I'm going to increase the delivery of the ozone to the liver, and the ozone is going to put the liver into oxidative stress, causing a detox, causing impurities and toxins to spill out into the blood systemically throughout the whole body. Ozone, this is just ozone doing all this with a little bit of antioxidant there, because I'm going to cause oxidative stress with the ozone. So it won't be as bad, because how do you treat oxidative stress? You give an antioxidant, hence antioxidant. Now, how do we get the ozone into this bag of blood? Is I have an ozone machine. It takes an external oxygen tank, brings oxygen into the ozone maker. There's a spark that happens inside here with a vacuum. That spark creates ozone and then pushes it out into this tube, and I attach this at the end of the tube and I pull my ozone out at a certain dose, a gamma. It's a dose. We're at 5 minutes, by the way, so much for 2 minutes. And then I take the ozone out of here really quick so it doesn't come out with a needle. which is right there, a small little butterfly needle. I puncture this little rubber here. I attach this to that butterfly needle and I push the ozone into the blood, and this blood turns really red. Right now it's dark red. Now I don't know if you can see that because of this light here. So let's turn that light off. This is pretty dark, okay? I'm gonna pause this, and after I inject the ozone into there, you're gonna see it turn really red. What does red blood mean? It's sort of like arterial blood, heavily oxygenated. This is venous blood. This IV is not inside of an artery, it's inside of a vein. That's what we want. We want deoxygenated red blood cells so that we can populate it with ozone. Ozone will attach itself to the red blood cells and the plasma of the blood and then go into systemic circulation once I hang this bag up and let the blood infuse in. Instead of it coming out of the patient, it's going to go back in, but after I put ozone in it. So I'm going to hit pause for now.